Hello, and welcome to this podcast, exploring how to choose a data standard. For Optum, I'm Jackie Walker-Gibson. Today's healthcare stakeholders must be able to pass relevant patient data seamlessly and securely across the network of care. To do that, healthcare systems must be interoperable, or at least able to openly exchange and interpret data within and across healthcare practices and systems. For interoperability to become a reality, all electronic medical record systems need to first speak the same language and incorporate the same types of information. A variety of data standards have been developed over the years to help systems speak the same language. Each data standard type, whether a messaging standard, document standard, or otherwise, comes with a variety of options depending on the vendor and type of data transmitted. Optum recently spoke with Salim Kizaraly, Solutions Architect Manager at OptumInsight, to discover the decision-making process stakeholders must undergo before choosing a data standard.
So if these organizations want to be able to communicate across that continuum of care, they need to be investing in the technology and taking advantage of these data standards so that their systems can communicate with whomever else they need to communicate with.
Correct, and it goes the other way around too, right? It opens up door for new business as well. If you're connected to somebody who's sending your institution referrals, making that process easy by connecting electronically and reducing errors and reducing paperwork and reducing the time that your administrative staff is spending on the phone tracking down documentation for the patient that's just coming to your organization, and most importantly, making your doctors' lives easier by providing them tools that enable them to save time and work more efficiently and all that. There's some very tangible, benefits to this as well. Healthcare organizations don't not only just have to give. I mean, they receive a lot as well as part of this.
So these data standards do they provide a roadmap to the organizations on how to create systems to translate this information between the silos?
Correct. Think of it as options. It's not one in
Right.
each category. There are under messaging standards. There's several of them. Under document standards, there's several of them. So it gives healthcare organizations really options. The U.S. health IT environment and healthcare system in general is perhaps the world's most complex system, in that you have all sorts of systems. You have a lot of ground to cover in terms of what each of them support in terms of standards, what each of them can do, what each of them can output, et cetera, et cetera.
Do you think that some of these standards will disappear as technology evolves and some of them stand out as being more efficient or easier to use?
Yes, absolutely. To truly ask and look around and out there, there's only kind of a handful of them that really everybody's going towards, and things are constantly changing. Earlier this year, there's a new standard that is in the works to, again, trying to fill the gaps that some of the current ones, are leaving. So there's definitely going to be a new one. There's going to be some that are going to disappear, and then there's going to be the ones that are going to remain, and naturally,
With that in mind, as you point out, you increase your risk if you choose the wrong standard, one that no one else adopts or that goes by the wayside. How can you lower your risk and make sure that when you do develop these IT systems, that you choose the best standard for your goals?
So it all comes down to, first it comes down to what it is that you're trying to do, and what it is that you're trying to exchange, what are your business and care goals, and a lot depends what kind of data you want to exchange. Am I looking at radiology images? Am I looking at medication data? What is it that I'm trying to do? Of course, it's important to also know, as part of this, not only what you're gonna exchange based on your business case and use case and so forth, the drivers, but also who are you gonna be exchanging and who is the partner? What can they do? Basically, all this analysis will help sort of create and limit sort of the risk. I don't know that many organizations truly understand the importance of data standards and, done enough homework. We often get people ask, hey, can you do CCD exchange? I say, well, what do you mean? Well, can you do CCD exchange? I say, well, what does CCD exchange mean? What do you want to exchange in a CCD? Where do you want it to go? Who do you want it to send it to? What's the clinical workflow around that, and so on and so forth. So, at the end of the day, you can talk about standards all you want. They all need to point and relate to, fundamental, use case. They shouldn't even talk about standards before understanding their use case and their workflows and their business, the end game.
To learn more about data standards for interoperability, visit ignite.optuminsight.com. Please note that all views expressed in this podcast are those of the speaker and do not necessarily represent the views of Optum.